Ladies and gentlemen, welcome to MedSynapse, the podcast that delves deep into the world of medical science, where we explore the latest breakthroughs and discuss topics that matter most to you. I'm your host, Dr. Nigar, and today we have a truly esteemed guest joining us, Dr. Mohammed Omar Bakri. He's a gynecologist and specialist in reproductive medicine, holding an Egyptian fellowship in obstetrics and gynecology and a professional diploma in reproductive medicine from Birmingham University. Dr. Bakri is also a proud member of European Society of Human Reproduction and Embryology. Our topic of discussion today is intracytoplasmic sperm injection, which is ICSI in short, a groundbreaking technique in the field of reproductive medicine. We will be exploring the intricacies of ICSI and its applications. So stay tuned as we dive deep into this fascinating subject with our expert, Dr. Mohammed Omar Bakri. Dr. Mohammed, welcome to MedSynapse. It's our pleasure to have you here today.
Welcome, Dr. Nijar. It's a pleasure for me too. Nice to meet you. Nice to meet you, our audience.
Thank you so much for joining us today on this very important topic. Now let's begin with our podcast. Dr. Mohammed, to begin with, what is intracytoplasmic sperm injection and when is it recommended as a fertility treatment option?
Okay. Reproductive medicine, by the way, is a unique specialty. Has lots of fine and good and very bad stories. Reproductive medicine, by the way, has a social impact, financial impact, and a psychological impact on the couple, all the families. All the nations named multiple women as they deserve God's wrath and punishment, as they don't see. By the way, alternative techniques brings happiness to the world. By the way, XE means injection of a single live sperm into the center of an egg by a special needle microscopically to the purpose of fertilization. We can do many reproductive methods. Percent of success of XE about to 50 to 60%. Infertility, by the way, means unable to conceive after 1 year of complete unprotected intercourse. XE, one of multiple choices in our reproductive medicine, we can recommend to couples by the mean who deserves exit, who can deserve exit, who can do exit. We have several methods and recommendation for our patients. Firstly, male infertility. Male infertility means sperm quality, count, morphology, motility, not good. So there is a problem. There is a problem in the main factor. Firstly, azoospermia means no sperm in semen analysis. We can define azoospermia, no sperm in semen analysis. We can differentiate between obstructive and non-obstructive azoospermia. Non-obstructive azoospermia unable to ejaculate without any obstruction, without any mechanical problem. Obstructive azoospermia means unable to ejaculate in the presence of obstruction or mechanical factor. What factor can cause azoospermia or azoospermia, tryptospermia, oligospermia? First, infection, chemotherapy can do, radiotherapy, okay? By the way, congenital malformations, absence one testicle or two testicles, absent vas difference, plus infection. By the way, male factor is essential factor in a choice X. There are several factors. Another female factor as tubal factor, hydrosalpinx, biosalpinx, tubal adhesions can add to PCO as ovulatory dysfunction. By the way, PCO should have Rotterdam criteria, 3 or 4. One of the items we mentioned as Rotterdam criteria. By the way, PCO, tubal factor, endometriosis has an impact, several impacts on tubes, on implantation, on fertilization. PCO, one of the biggest factors can affect ovulatory dysfunction. PCO means oligomenorrhea or amenorrhea, clinical or biochemical hyperandrogenism as Hirsch's acne, alopecia, will ultrasound criteria of Nicholas appearance of both ovaries can add so. The last, unexplained infertility, both couple, the couple is normal. Couple normal, everything, every investigation are normal. Hospital benchography as initial assessment of normal. Seminal passes as a treatment of male factor normal, ovulation after several months is normal. So we diagnose the couple with an infected vaccine. About 15 of couple diagnosed.
Dr. Mohammed, are there specific criteria or specific conditions that make a patient a good candidate for ICSI? Like, how do you determine if this method is suitable?
Good candidate includes the male factor as the male factor, aspermia, oligospermia, spleen oligospermia, everything can change the quality. Unable identification reflective disorder, deposition disorder has importance, reflective disorder has retrograde ejaculation, or unable to do the test intercourse. By the way, female factor can add as reproductive dysfunction, endometriosis, PCO, human factor can add so. Plus, unexplained infertility.
Also, what are the success rates of ICSI and what factors can influence the chance of successful pregnancy through this procedure?
Successful rate differentiate between several factors can affect success rate. By the way, success rate is about 50 to 60% overall. But many factors can influence rate and the age. Age is the main factor can affect anything. Age, especially age of the female. Second, health weight. Before any cycle, we prepare the female to reduce weight. Reduce weight very, very important in this case. Stress, decrease stress. By the way, we recommend psychological support or postpartum, reduce stress, depression, as we do something benefits for them. We can also benefit from them. With conception, this is a trial. We do counseling for the patient, this is a trial for conception, not getting pregnant. Or no, by the way, completely, definitely get pregnant. This is a trial. This is a trial, so we relieve stress. For good counseling. Choice the best protocol. We have two protocols. Agonist protocol and antagonist protocol. Plus, we choose the best protocol for every case. I think with IVF with an expertise in research and to benefit from the case.
Now, moving on to our next question, are there any potential risks or complications which are related to ICSI that the patients should be aware of?
This risk of complication of anything. But the risks is about يعني not 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 long. Uh, hemorrhage due to trauma, due to ovarian hemorrhage, internal hemorrhage, and spinal injury, vascular injury. We can do harm every case. By the way, a little bit less common. This is uncommon. Vascular injury, spinal injury, ovarian injury, internal hemorrhage. Many cases happened after internal hemorrhage. Also, it's common. PID cases with severe endometriosis or human in one ovary. Puncture the ovary can also harm if there is endometrioma. We can add some benefit to harm to the pelvis, PID, OHSS, the nightmare of X, nightmare, OHSS, ovarian hyperstimulation syndrome, exogenous exposure, a response to excess hormones, leads to release of vasoactive substances such as vascular endothelial growth factor, interleukin 6, interleukin 8, decrease intravascular volume, leads to hemoconstipation or hypovolemia, compartment syndrome, and hepatitis and vitamins. We can assess ovarian hyperstimulation syndrome or mild moderate severe critical cases mainly significant. So might mean something incident for it. We can decrease the essence of consciousness by several methods. First, antagonist protocol can decrease the essence of HSS. If occurs, we can manage case according to the degree of OHSS. Mild, moderate, severe, critical. We can manage mild and moderate cases safely. Severe and critical cases needs hospitalization. Critical cases needs ICU.
Now, coming to our final question, what alternative fertility treatments or procedures should patients consider, and how are they compared to ICSI?
There are several how compare FT to IOI. The most common two methods present nowadays. IOI doesn't about symptoms compared to FT 50. IOI means injection of well concentrated kernels into the cavity, uterine cavity, with ovulation for the This is the difference between the method of IUI and the method of XP. IUI just revealing, concentrate the sperm sample and inject it into a vagina. XP, by the way, have several steps. First, revealing case and good counseling for couple is a method of conception, a trial of conception. We should mention the success rate to every case. Every case has a success rate different from the other case. Not all the cases 50 to 60. In many cases, according to their age, exit success rate may be low or 50, about 40, 30, 20, according to the age of the result and ovarian volume, quality, sperm quantity, everything can affect. Next, ovulation induction. Ovarian cyst. How to get many follicles from the ovary to prepare them for fertilization and IVF. We don't need one follicle or two follicle. We need multiple follicles as much as we can. Thanks and for yeah, to inject. Third, organ pickup. We use a special needle transvaginally guided by transvaginal to pick and aspirate the blood flow. Two sides isn't inside the follicles. We can aspirate and puncture ovary to collect multiple follicles and multiple. Fourth, live effect. Live effect of a single sperm into the center of an egg for fertilization. After 3 to 5 days, we can do embryo transfer. Embryo transfer, mostly one or two, mostly. One of the complications of pregnancy, micropregnancy, we can add so harm for the patient if we transfer more than 3, 4 embryos. If you get pregnant, 3 or 4, we can do fetal transfer.
Thank you so much, Dr. Mohammed, for sharing your insights and experiences on this very important topic. We're definitely looking forward for many more podcasts together. And to our listeners, if you found this discussion as informative and insightful, make sure you subscribe to MedSynapse podcast series. We will continue to bring you the latest insights, experiences, and expertise from medical professionals. Don't miss out the opportunity to learn and grow in your medical journey. Thank you for tuning in, and we look forward to having you with us in the future. Stay connected, stay informed, and don't forget to subscribe. Goodbye.